Okay, I think it's time. We gave 2 minutes for the late joiners to come to this beautiful event, and so I think we can start. First, I want to thank you all for joining our event on containment and deterrence. There are a couple of reasons where we believe it makes sense to hold this event today, and I'll go a bit into details. But first of all, thank you very much for cutting 2 hours of the middle of your day. I know you're all very busy. We have over 200 people listening in, which is absolutely amazing, and we are live streaming this on Facebook and recording it for later use. So thanks a lot for the high interest. I think it's very timely, and that brings me also to the first reason why we are currently hosting this event. I think there is the tendency in politics, obviously, to go into a cyclical topics. So basically, for some time, refugees are on the top of the agenda, and at some point it somehow waves away again. And I think at the moment, I feel that the public attention on this topic is too low for what it is, which is really a bad humanitarian crisis. So I think that for itself, it was a reason for me to organize this event. The second and also more institutional reason is that we all know that there's going to be a new pact on asylum and migration, and we're all waiting for that because it can't be that the European Union cannot agree on a common European asylum and migration system. And so I'm very happy that this is going to happen. But also, I think it's very important that we take the lessons that we can see from the current failure and transform them into learnings, so that whatever we come up with is not worse than the current situation and mitigates the risks and vulnerabilities that we currently see. So that's why I think it makes sense now, before the new pact by the Commission is produced and presented, to summarize a bit where we currently stand, to address the current situation and understand what we can learn from it. And that is the idea of this meeting today. Just as a quick wrap up of the current situation, I'll make it very short because we have the experts here who will be much better positioned to give you an understanding of where we currently stand when it comes to the Greek islands and containment and deterrence. But I mean, we all know that COVID-19 really worsened the situation for the vulnerable on the islands, and that while currently tourists are allowed back in to travel from Germany, for example, to the Greek islands, the camps are still being closed under COVID-19 measures, which creates hardship and tensions. In addition, the new Greek law, which came into effect and which we will hear also about, created a horrible situation and made it difficult for NGO services to actually help with medical services and others and legal aid NGOs. And we will hear more about this in the first panel. I mean, there are some positive notes. We've seen that there's to some extent a relocation happening. Last week, for example, Portugal and Finland received 50 separated children in their countries, and Germany and Luxembourg have already started. But I mean, we all know that this is not enough. For me, it's absolutely clear that the camps as such need to be vacated. And if you have camps with several thousands of people, obviously it does not, it can never be enough to just relocate such a small amount, especially also if you have the situation that people are currently stuck on freighters and are not allowed to disembark because there's no willingness to actually accept them. While on the other hand, we know that regions and cities across Europe are interested and willing to support refugees and asylum seekers in need. Okay, I'll now pass on to Stephanie Pope. Just one quick change of agenda. Fabian Keller will have to leave the meeting earlier, so we will allow her to speak after the first panel already for her intervention. So if you have any questions, do feel free to put them in the Q&A box. So you will see this, and that's possible for all viewers. You will see the Q&A box within the Zoom tool, and you can ask questions there at any time. I actually encourage you to do that, and we will in all panels have the chance to take some of your questions up. So it would be very good if you actively participate in this debate. Now I'm very happy to pass on to Steph. Steph, thank you very much for moderating this event to a large extent today. I'm very happy that we can do this together. You have been a great help in understanding the situation on the Greek islands for me in the past, and so I'm very happy that we can do this. And I'm very excited and interested to hear the accounts of all the different panelists going forward. Thank you very much. Wait, now I need to quickly allow you to actually unmute. Okay, now you should be able to unmute yourself.
Yes, thanks. Hi, Damian, and thank you very much. Hello, everyone. I'm Stephanie Pope, and I work for the NGO Refugee Rights Europe. And as Damian said, we're delighted to see such a good turnout today, despite it being the last few very busy days before the summer break. So thank you for that. I'll move us right on to our first speaker, who is Spyros Vlad Oikonomou from the Greek Council for Refugees, who has many years of expertise and experience regarding the Greek hotspots. So Spyros, while we've recently heard quite a lot about the very concerning pushbacks in particular and related developments also in Greece and of course elsewhere, since the lockdown and also the COVID-19 situation generally, there is a feeling that we seem to be hearing less and less about what's actually happening in the hotspots and in the camps themselves. And undoubtedly, this is also due to even less NGO access at the moment, and of course, fewer journalists being present. So perhaps you can just start us off today by outlining the latest developments in the hotspots and in the camps. Thank you, Spyros.
Thank you, Stephanie. Well, hard to actually, and thank you for the great presentation, actually, introduction. Very hard to actually describe, to be honest, anything new in what regards the hotspot camps, because for more or less the last 5 years, we have been witnessing the same situation again and again. Unfortunately, today's discussion comes in the aftermath of yet another tragic incident in the Moria hotspot. Last week, we had severe clashes between residents of the camps. 3 persons ended up hospitalized, and one 90-year-old young man lost his life. What the cause of this has been reported as the theft of a phone. Yet I think that we can all understand that when we are discussing about camps and situations and conditions whereby thousands of persons which are seeking asylum and a better life are trapped in such conditions of severe overcrowding, without access to crucial services and support, without access to a shelter, and while being subjected to differential treatment depending on their nationality or their time of arrival, we are in practice discussing about the immediate effects of what is a 5-year-old failed EU hotspot approach in Greece. These are just a few elements, I think, that impact further on what we see today, on the tensions we have seen last week, and ultimately on the despair we are seeing each and every day in the hotspot facilities, which in turn create the conditions for despair, for frustration, and for such tensions to arise. I wish to just provide a very brief overview of some of the latest developments. They are not precisely last-minute ones. They are, in a sense, a trend we are seeing throughout this past year. In practice, a political choice to double down on the exact same approach of confinement of asylum seekers at the borders, whose results we have been experiencing for the past 5 years. And I wish to only focus on 3 points. Of course, I'll try to be very general, so if anything seems unclear or you feel it is in need of more elaboration, please feel free to ask me any questions you wish at the end. So the first point is that in 2020, as you know, Greece has a new legislation on international protection. It has already been amended once in May. One of its main problematic aspects is the fact that we have the first time inclusion of vulnerable categories of asylum seekers, such as victims of torture, of violence, and so forth, in the so-called fast-track border procedures on the islands. The legal aspects will be further elaborated by my colleagues in the process of the discussion, so I don't want to focus much on them. Of course, there are issues that have to do with the fairness of the procedure, of how you can guarantee the safeguards of the asylum procedure within within so short deadlines, the very short deadlines of the border procedure, especially in view of the severe gaps in legal aid. But the main point I wish to highlight at the moment is that by including in practice a further category of asylum seekers that can be restricted on the islands throughout the duration of their asylum procedure, in practice, with this law, you create the conditions for more and more persons to remain trapped on these islands under these unacceptable conditions, inhumane conditions, with no access to crucial services to healthcare, to nearly anything. Because for all intents and purposes, for the vast majority of asylum seekers that have arrived in Greece for the past 5 years, there is no reception system. The second point in what regards to legislation is that it lays the ground for an exponential increase in the number of administrative detainees. So transforming detention into the rule of managing arrivals instead of the absolute exception provided by EU and international human rights law. Already, since the start of the year, we have been experiencing a significant increase of detainee asylum seekers throughout the islands. This concerns both detention in police facilities, police cells, which are never fit for purpose, but also in the two pre-removal detention centers in the islands of Lesbos and Kos, where since February, if I'm not mistaken, maybe it's since January as well, but at least since February, we have been seeing an expansion of detention measures, and both facilities are at the limits of their capacity. The most problematic case in this context is that of Kos. Since the 27th or 28th of January, if I remember correctly, every newcomer on the island, upon arrival, is indiscriminately subjected to detention. The sole exception here are unaccompanied children, but again, this is only in theory mostly, because frequently, and this is applicable to the whole of Greece, due to gaps and challenges and deficiencies that have to do with the system of reception and the overall framework of age assessment, we have frequently cases of unaccompanied children who are identified as adults, wrongfully identified as adults, and as a consequence, detained alongside adults. In Kos, we have the same exact examples. Even today, we have cases of unaccompanied children asylum seekers who are detained in the facility, in a facility which doesn't fulfill standard living conditions. And I mean, you can see, for instance, that there are areas of the facility that are still filled with sewage water. However, and actually the most tragic issue is that even amidst these unsuitable conditions, the pre-removal center of Kos is actually amongst the better, let's say, pre-removal centers in terms of condition. It's still unsuitable, but I don't think we can even imagine what happens to the rest of the facilities. I mean, it's terrible. So we see an exponential increase based on detention, based on the law. In what regards detention in Kos, we are discussing about families with very young children, as far as 5 years old, asylum seekers, all of them. We're discussing about very vulnerable asylum seekers, such as single women, survivors of gender-based violence, and many persons who are in need of medical and mental support. It is also their right. It's not just a humanitarian obligation. It is their right, but they have absolutely no access to it. Currently, as we speak, the detention facility in Kos only has one nurse. Both of these aspects are problematic because actually in Kos we also had the highly paradoxical case whereby throughout the pandemic, at the height actually of the pandemic, between March and May, refugees who had their status recognized while in detention in the facility were simply left, were released and simply left with absolutely no plan of what they would do. The reception facility would not accept them even for the temporary accommodation. Everything was in lockdown, and even if they had the possibility, the resources to somehow rent a place for themselves, they couldn't because nothing was working. So at the height of the pandemic, you had persons who are recognized as refugees. They are detained in violation of their rights and subsequently recognized as refugees and simply left in limbo. We see the same exact lack of planning in what regards the next step today with refugees who are recognized in Moria, for instance. From there, they are simply left after having to experience the terrible conditions they had experienced in Moria. They are simply left in limbo, ending up homeless in public squares, and at best, which is of course ironically at best, in once more in camps, albeit this time in the mainland, where exactly due to the conditions of additional overcrowding created due to this lack of long-term planning on integration, we now have instances and hearing reports on the fact that food provisions are not sufficient for the entire population. So in a sense, you see that the problems that are characteristic of this European approach in the hotspots is in a sense transferred on the mainland. Either way, as you can understand, it is impossible either in the island camps or in the detention facilities to actually ensure the rights, the well-being, the health, and the proper provision of services to persons who arrive in Greece seeking asylum and a better life. It becomes even more concerning amid the pandemic, and even today, as we speak, when everything has returned in a sort of normality, when restrictive measures have all but been lifted, when we are welcoming as a country our first tourists for the season, the restrictions in the hotspots by reference to the pandemic are ongoing and perpetually renewed. This here is what we discuss is about a disproportionate restriction on the movement of asylum seekers in the hotspots on account of a supposed attempt to, I'm not sure to safeguard their health. This is an actual impossibility when you have to live in conditions in tents, in summer tents, or on the ground next to garbage dumps. I mean, it's a bit ridiculous to consider this. But in any case, it is a disproportionate measure to the extent that we are informed by medical organizations there are absolutely no medical grounds for this ongoing restriction. Of course, asylum seekers, refugees, and migrants who are trapped in the hotspots and in their premises do not have access to necessary wash facilities. And of course, it goes without saying that physical distancing is an absolute impossibility. It is this very context of the pandemic whereby one would expect for the state, for Europe, for everyone to actually reassess this problematic approach and see at the end of the day this pandemic as the 25th hour opportunity to actually reassess it and transfer this population from the islands to suitable accommodation on the mainland and in other EU member states, where they can remain in dignity with access to the crucial services they require and to which the European states are obliged to provide, for as long as they remain on European soil. It doesn't matter that someone has to be recognized as a refugee in order to be treated humanely. Everyone has to be treated humanely based on our legal frameworks and, at the end of the day, our joint European values. So, in terms of the COVID restrictions, now they have been extended up to the 19th of July. There has been a small increase in the number of persons that can leave the facility. So instead of having the possibility of having 100 persons being able to leave the facility for within a 12-hour framework per day, now you have 14 hours during which 150 persons per hour can leave the facility, which still is problematic because the vast majority of asylum seekers remain trapped in the hotspots and their perimeters. They are in practice also denied of any possibility, at least a short respite, to take a walk in the city, to forget the conditions in which Greece and Europe are forcing them to remain. And at the end of the day, it is an ongoing measure that introduces a divide between what is applicable for the population of refugees and asylum seekers and what is applicable for the entirety of the population in Greece, the rest. Both of these aspects, both this regime of detention, if you will, in Kos, and the ongoing extension of COVID-related measures and restrictions in the hotspot provide significant cause for concern. As you may know, Greece is in the process of transforming its, up to now, quasi-open, let's call them, hotspot centers into closed/control centers. And we are very much afraid that both these aspects, the restrictions and the regime of detention and Kos, are the facets of a pilot approach, of a pilot implementation of these centers. Of course, services cannot be guaranteed as things currently stand. And just to close up, because I know I think I already used a lot of your time, the issue is that as MEP Bosla also mentioned, and as Stephanie also mentioned, we also have this these new initiatives by the Minister of Migration and Asylum in practice on establishing new criteria and a new registry for NGOs working in the field of asylum and migration. I don't want to focus a lot on that. There has been an opinion of the Expert Council of NGO Law of the Council of Europe, which I highly recommend as a reading. There are, of course, issues of compliance with EU standards. The main issue in what regards the ability to actually ensure humane reception conditions to the population of asylum seekers on the islands relate to the disproportionate requirements placed, especially for everyone, but which are especially difficult to comply with from the side of smaller NGOs. Already on Lesbos, we have a series of NGOs which have been unable to comply with these disproportionate standards, and as a result, will cease to operate. And they are organizations which have been providing a significant supportive role in terms of service provisions and in terms of at least trying to create a semblance of humane conditions in what otherwise are an absolute, I'm not sure how to best state it, a very challenging in any case situation for asylum seekers and refugees. So in this probably highly convoluted, with this probably highly convoluted presentation, I wish to finish and hand over the floor to our next speaker. And thank you for your time.
Yes, thank you very much, Spyros, for that overview of what are indeed very worrying developments, and they clearly very strongly suggest that the hotspots on the Greek islands and related border procedures should not become a model for further EU asylum policies, also in the framework of the Upcoming Pact. And just a quick note to say, please do continue sending your questions as you have been through the chat box, because we will have a short Q&A after each panel. For our first panel, I'd like to now turn to 3 NGOs working on the ground on the Greek islands to elaborate on how the measures that Spyros described are impacting their services and the people they work with directly. So we'll start off with Amanda Munoz de Toro of the NGO Phoenix Humanitarian Legal Aid in Lesbos, after which we will be hearing about the mental health impact of these developments from Georgia Karoutsu of the International Rescue Committee, as well as finally about the impact on children and relocation from Julia Chicholi of the NGO Still I Rise in Samos. So Amanda, turning to you, how have the developments we just heard about from Spyros impacted the asylum procedures in the hotspots, as well as access to legal aid and your NGO's work on Lesbos more generally?
Thank you, Stephanie, for the introduction. Well, as many know, and as Spyros has mentioned, the situation in Lesbos has been a breaking point for many months now. The past months leading to the COVID-19 outbreak have been devastating for locals, for humanitarian workers, and for asylum seekers. In February, the influx of asylum seekers to Lesbos and the central government new policies to establish detention centers in Lesbos resulted in unrest and anger from the local population and attacks against humanitarian workers. So although Phoenix decided to stay, other international actors, including very essential legal and medical organizations, shelter organizations, had to evacuate part of their staff of the island. It has taken until now, until July, post-COVID, or now that we are flexibilizing again the measures of COVID, to go back slowly to normal capacity. So in March, the Greek government responded to the first cases of COVID by a quick lockdown of all non-essential movement on the island. But by mid-March, the government implemented special measures for refugee camps in Lesbos, which continue, as Spyros was saying, until today. No one was allowed to leave Moria camp except for medical cases. So they had to have a document from the hospital saying that they had an appointment in the hospital. Otherwise, that meant no visits to lawyers, no mental health, no education, no visits to other doctors except for the hospital, no going to the supermarket for buying food. These measures were enforced by police checkpoints on both sides of Moria camp, and initially, only, as Spyros was saying, a very limited number of people could leave the camp. And this was with an overpopulation of 20,000 people in Moria camp. So as most people know, in Moria, there's no possibility for self-isolation. Tents are cramped one on top of the other. There's very few water taps, and sometimes there's even no water in the camp. So these government measures expose the community in Moria to a greater risk of the spread of corona by forcing them to remain in subhuman conditions inside the camp. So added to these measures, the cash distribution was suspended by the government. So this was to prevent people wanting to go to town to take out cash. So people were left in Moria without access to the basic income that they get every month. Added to this, the camp staff was reduced dramatically, which meant limited camp staff for the unaccompanied minor sections, for the women's safe areas, for the sexual violence teams in Moria camp, and even less presence of UNHCR staff. So given this decrease in NGO and camp management present in Moria, the lockdown of the camp, the suspension of cash distribution, the suspension of mental health services, there was a sharp increase of violence against children and women in Moria camp. So only our team in Moria, the Phoenix team, reported 60 cases to the authorities in April. Among these cases, there were cases of police brutality, domestic violence, sexual violence, suicide attempts, and knife fights, and very, very little, if not none, services to provide support to the survivors of these events. So from the Greek Asylum Service, notwithstanding the suspension of their services to the Moria population, the camp continued to serve decisions, most of them negative. And the people, once they received this negative decision, were not allowed to go to town to visit their lawyers. In the case of those that were giving positive decision, as Spyros was saying, they were informed that their benefits would be cut 1 month later, but they had no way of going into town to find accommodation or to find a house or even to leave the island if they had possibilities in another area of Greece. Regarding new arrivals, many were abandoned in the beaches and others were put in a bus in the port of Mytilene for 24 hours without food. In May, the government started to announce the relaxation of the COVID-19 measures for the whole of the Greek population. But however, the lockdown of Moria camp and of Karatepe camp continued, which meant that people were still having limits to access essential aid, such as legal aid. So in May, the Greek Asylum Office reopened finally after 2 months of closure. And during this closure, they notified at least 1,000 issues of rejections for their asylum claim. At this point, people were still not allowed to go to see a lawyer. And in fact, many people that were seen outside legal NGOs offices in Mytilene were issued fines for violating the movement restrictions. During May, we also started seeing the transfers by UNHCR and by the authorities of people that were considered high risk for corona outside to the mainland, to apartments or to hotels. In many of the Phoenix cases, we were able to observe that our clients were not really moved to apartments or to hotels, but in fact just moved to a different camp. So people that had HIV, for example, were not moved to a hotel as they were promised, but rather just put in a different camp. An ATM machine was also installed. So people, instead of being able to go into town, had one for 20,000. So one machine for 20,000 people in Moria, which obviously meant eternal queues and more risk for the outbreak of corona. So now in June, the head of the coordination legal subgroup has advocated to the asylum office that people should be allowed to leave to Mytilene to see their lawyers. So people are able to get an authorization to go to Mytilene to see a lawyer with an appointment from the legal NGO. At the moment, we are seeing that this is slowly working, but obviously it's a burden for the legal NGOs, and also it's a burden for the authorities in the camp to have to issue these decisions. Slowly, as services are going back to normal, NGOs are being able to bring their staff back and to have normal capacity again. MSF, for example, has still not reopened their mental health clinic in Mytilene, but rather are working with older staff in Moria, which obviously means that they cannot provide the same amount of mental health support. IRC, who is also a very important actor regarding mental health, has started to reopen in the last days, and before we're just doing it by phone. And like this for many essential psychosocial, educational actors. So most of the actors are having to rethink their activities, having to find a space next to Moria, because we don't know how long this lockdown will continue. and how long we will have to wait for people to be able to access these essential services again. So the latest development today, which is a very important development that was discussed in the Moria coordination meeting, is that MSF and the Central Medical Corona Triage that was set outside Moria to screen for Corona was issued a 60,000 euro fine by the municipality of Lesbos, and supposedly there might be some problems for them to continue providing these services. So at the moment, we don't know if this clinic will be allowed to continue, and if it's not allowed to continue, that will mean that the screening of Corona patients from Moria camp will have to be moved to the main hospital with all of the pressure that that means. And we always know that pressuring the local community could bring further clashes between the locals and asylum seekers, as we suffered in February. So Stephanie, that's it from my side. I'm very happy to respond to any questions that there might be from the audience.
Thanks, Amanda. We'll be keeping the questions to the end of the panel, so we can move on to the next panelist now. Georgia, are you ready?
Yes, hello, everyone. Thank you for the invitation, and it's a great pleasure to be here today and to discuss about the mental health status of the refugees and the migrants, and the impact that all these the developments that happen in these past 4 months have on the mental health status of the refugees and the migrants. I hope that my connection is going to be okay, because I had some problems a couple of minutes ago. Well, I want to briefly say that to introduce myself, my name is Georgia Karoudjou. I am a psychiatrist, and since May I am the head of the mental health and psychosocial support programs of the IRC office in Greece. And we are providing mental health and psychosocial support services in Lesbos, Chios, and Samos islands. I would like to take some time now and invite all of you to take a few seconds to reflect on your own emotions, thoughts, and perceptions during these past 4 months with the outbreak of the pandemic and the lockdown. How did this affect your own mental health and well-being? Please feel free, if you feel uncomfortable, not to do this exercise, but I give you a few seconds just to reflect. Now, please take a deep breath, shake a little bit your body, legs, hands. The well-being of all people is interconnected to our basic needs, such as individual freedom, establishment of security, basic physical needs such as food, shelter, water, healthcare, control of communicable diseases. Globally, these past 4 months, people are in a grieving process. They are mourning of losing their beloved ones, their health, their daily routine, their lifestyle, their safety, and the certainty that they had. Refugees and asylum seekers have been already facing lack of protection, lack of support, and lack of any certainty about their future. And this has negatively impacted their well-being and mental health status before the pandemic. The most common MHPS mental health symptoms and problems that were presented by the people attending the IRC psychological support services include more than 70% sleeping problems, depression, anxiety, and we also have high rates of suicidal thoughts within our IRC cohort. And we have also high rates of people that they have committed suicide. They had a suicide attempt at some point in their life, either in their countries of origin during the transit and in Greece. Refugees and asylum seekers who are a high-risk group due to the precarious living conditions that Spyros and Amanda already have described in such detail, now they have to face one more challenge, vulnerability, the pandemic and the lockdown. All residents, at the reception centers are kept in lockdown, as we have heard, for much longer than the rest of the population, and the psychological impact of this cannot be underestimated. The reasons of the restrictions have not been communicated to them, and they don't understand what is going on. They are among the most vulnerable to mental health impact of the isolation measures. People that receive mental health support in our programs share feelings of imprisonment. They feel abandoned, humiliated, as everyone was telling them that the restrictions, and they are still telling them that the restrictions were put in place for protection of their own health, but at the same time, as it was described, no measures of hygiene or social distancing were put in place. So in addition to the mental health symptoms and problems that I have already mentioned, such as depression, anxiety, insomnia, the majority of the people now experience fear, despair, distress due to the daily exposure to violence and criminality that has been reportedly increased in the camps since the lockdown began. Our psychologists, IRC psychologists, on a daily basis share the stories and the testimonies of their cases. And one of our psychologists best described the current situation. I quote, "All these have a critical impact on our case's mental health, steering to relapses, ongoing psychological traumatization, increase of depressive and anxiety symptoms. In regards to my work as a psychologist, I realized that these conditions drastically counteract and frustrate our interventions." Another psychologist stated, "One of my cases mentioned that yesterday night a gang attacked his tent by throwing rocks and intimidating him and his roommates. As he stressed, gangs were persecuting people during morning hours, threatening them with knives. We even hear the threats via the phone, and our case, the people that we follow up are fearful. The conditions above are a daily routine to the majority of our cases, as violence and criminality is a normality in Moria camp, that is in Lesbos Island. So what needs to be done? We need to improve people's access to essential needs, including food, healthcare, protection, to feel secure. Immediately lift the restriction of movement that currently only applies to refugees. It is not supported by medical data and it constitutes discrimination. I think Spyros already mentioned that. Decongest the island so people do not have to live in overcrowded camps where they cannot protect themselves. Even they are at risk of infection from COVID-19. And starting with those that are most at risk, such as older people, people with medical problems, illnesses, and disabilities, and of course, children and women. Thank you very much, and I am open to questions later on. I cannot unmute myself, I'm sorry.
Thank you, Georgia. And we'll now move on to Julia Chicholi.
Hi, Stephanie. Hi, everyone. Thank you for being here. I'm Julia from Sea Rise. We run a youth center on Samos for children aged 12 to 17, among which many unaccompanied minors. So although we are not involved in the relocation scheme, we know most of the kids really well because they've been with us for a very long time. So today I would like to take this opportunity to talk about the relocation program. Obviously, all the panelists before me have talked about the recent developments, which are quite horrible during the pandemic, with pushbacks, eviction of recognized refugees, lockdown, and the new asylum law rejections. But the relocation program is actually a ray of sunshine. some European countries on a voluntary basis have pledged to take in between 1,600 and 2,000 unaccompanied minor children stranded on the Greek islands. This is really something we have advocating for a long time, and it is really good news. Whatever you might have read or heard about the camps on the mainland, on the islands, it's actually a million times worse. You're all aware of the horrifying hygiene conditions. The camp on Samos is infested by rats. Our kids are beaten by rats constantly. We have to replace backpacks all the time because if they forget food inside, the backpack gets destroyed overnight. But on top of this, there is an absolute and total lack of protection for children, for women, for everybody working in the camp. We have constant cases of sexual abuse. We have, as the panelists said before, mental health crisis, which also led to attempted suicide by unaccompanied minors, and there is no protective net. There is no emergency shelter here, whether it's for women, unaccompanied minors, or anybody. So even victims of sexual violence who have the courage to come up and report this to the police are then sent back to camp where their perpetrator lives, or unaccompanied minors committing suicide are being kept on the floor of the local police station for 10 days as the safest place, and then released back to the camp. So the conditions are incredibly horrifying. There is not one single right of the child that is upheld here. Relocating children to other countries actually means giving back their rights. We have a few kids who were on the first two transfers to Portugal and Finland. And although it was really told to them last minute, they were told the day before that they were leaving, they had no idea where Portugal or Finland were or what it was. But still, they're really, really excited about basically building a new life, finally, where they have their rights respected, but also they can study and grow and become active members of society. So the only point I have on this relocation scheme is about transparency and criteria. So I understand it's obviously not that easy to put together many different countries with their systems, their requirements, their criteria, but this hasn't been that transparent at all. It hasn't been for us as an NGO, but mostly it hasn't been to the kids. We have many students coming to us quite stressed out. For example, the first transfers that we've had mostly Afghani minors in it. And nobody can answer the question, why are Afghanis going first? There is probably a reason, but staff here on Samos doesn't seem to know. So some kids have left. They're now in Athens waiting for their transfer to France, which left the French speakers quite upset, saying, why are they going first before us? Nobody can give an answer. So there have been problems on level 2, the so-called safe zone that is not a safe zone, because kids get very, very anxious. They don't know when they're going, what is going to happen to them, why are the Afghanis going first? So if communication to the children could be done better with a better system, explaining how it's going to work, how often are people going to be transferred, in what numbers, are there any criteria in terms of age or vulnerability or whatever, that would really, really reduce the anxiety, because these children have been here for a very long time. They don't trust many people anymore after everything that has happened, especially during the pandemic. So they really need to have clear instructions and clear systems. Obviously, we really, really wish that this scheme can become the norm, so that it's no longer a volunteer, countries volunteering for this scheme and as a one-off, but it can be kind of a structure, ongoing procedure, because Greece does not have any kind of infrastructure. I mean, they do, but it's very limited on the islands, but also on the mainland, to care for unaccompanied minors. Which also lead me to the second point, which is that thanks to this relocation scheme, a lot more staff has been deployed on Samos to to deal with this scheme, which actually means that people working with unaccompanied minors in the camp are able, have enough staff to do what technically they were supposed to do all along, which means knowing where the kids are, just as simple as that, registering them with the asylum office, doing the best interest assessment, understanding if they have family somewhere else so they can apply for family reunification. And if this scheme ends and then the staff is sent back again, we go back to our winter, which was 300 unaccompanied minors, one guardian who obviously could not care for all of them, no lawyers, so many children missing out on family reunification because of deadlines and having no support, and kids just being stranded here over Christmas. In December, we had a month where there were riots in the camp. The medical unit was destroyed. So for over a month, there was also no medical support. A lot of the children had very bad scabies, which also means they can't be transferred, even if a place is found for them, because if they have scabies, they can be transferred. So it's really important that this stuff stays, whatever happens, so that children are actually looked after. While at the same time, European states need to be more flexible on family reunification. We need obviously more legal support here to identify kids who qualify, because it is their right to be reunited with their family if they have any in other European states. In most countries, there are really strict deadlines of 3 months since arrival. The family member in the other European state cannot apply on behalf of the child. So it has happened multiple times that kids have been here for even up to a year, then being transferred on the mainland, and then they absconded trying to get to their family through the Balkan route, which we know how dangerous and violent it is, just to be reunited with their family, which is their right. And it is obviously in the best interest of the child for them to stay with their family. So revisiting, being more flexible, having more support for family reunification is key. Also, if there are any other future relocation schemes, it is vital that homeless children are involved as well. Many are homeless in the streets of Athens or in protective custody with the police because it's the safest place they can find for them because of the chronic lack of shelter for unaccompanied minors. So to conclude, I think we really need this scheme to continue, but we also can't forget that there are thousands of children with family who are as vulnerable as children without family, who are stuck in these horrifying conditions for months or years with no rights. They are completely missing out on their childhood with no access to anything, let alone education, kept in conditions that are not fit for animals. So these schemes should really be extended at least to children with families. At the same time, we also need to strengthen services in Greece. We need more lawyers, we need more doctors, we need more emergency shelters or shelters in general, not just for unaccompanied minors, but for vulnerable people in general. We still have at risk of COVID-19 camp residents that are still in the camp. And I mean, at the beginning of the pandemic, it was quite chaos and difficult to organize everything, but now it's been months. So it is really, really crucial that something happens and that it happens soon. Thank you, and I'm happy to answer any questions.
Thank you very much, Julia. And just briefly, while we're on the topic of the EU hotspots not being a safe place for children and unaccompanied children, I'd like to take this opportunity to draw all of your attention to a paper that was shared with you in the reminder email you all received. It's by the NGOs Child Circle and Kind, and it outlines key recommendations concerning the treatment of unaccompanied children in border procedures, as we know that proposals for such procedures in facilities at EU borders might be included in the pact. And needless to say, unaccompanied children should not be included in such procedures. So we encourage you to have a look at that along with the reports by Greek Council for Refugees and Oxfam, which were shared with you. I'd now like to move on to our question for this panel from the audience. And unfortunately, due to time restrictions, we can't cover all questions, but we will try to get answers for you in the follow-up. May I just ask all the panelists to switch on their videos and unmute their mics so we can have a quick discussion. Our first question is from Joel, who is a freelancer on Lesbos, and it's a question for all the panelists. And it reads, what can we as the audience do to support your efforts directly and indirectly? And perhaps Amanda or Julia, you could start us off with the answer.
I can go ahead if you want, Amanda, and then give you some time. So this is a question I'm asked a lot. Obviously, by supporting organizations financially, by getting involved and so on, but mostly I really think it's important to raise awareness of what's going on the Greek islands. So many people have no idea what's going on because they think, okay, this is Europe. It's not a war-torn country. There are rights, there is democracy. There is no way this is happening. But when you start looking into this and understand how horrifying the conditions are, I think people will speak up more. And that's what we need, because the European Union also seems to kind of be following the new government strategy. And if people don't speak up and there is no position whatsoever, things will keep going towards this direction. And the pandemic was a great excuse to keep cracking down on refugee rights. Again, we went from, okay, the extension of the lockdown, recognized refugees being evicted like that, to the pushbacks at sea. We've all seen the video and the government still denies that it's happening. And it happened so quickly, where the focus was somewhere else on coronavirus, that even we didn't have time to say anything about it, because every week is something new. So people really need to speak up to as many people as possible to raise these concerns.
To add to what Julia is saying, which I support fully, besides advocacy and raising awareness, many NGOs on the island need medical staff. So there's still a shortage of medical staff in Lesbos. So if you know people that are interested in volunteering, they can look up at the websites and see who's recruiting. And from our side, also lawyers. So there is a big need for international lawyers, but obviously also fundraising to bring more Greek staff to the islands.
I think both Julia and Amanda have already covered that, but I want to emphasize, make this public and visit the islands, see what is happening there, go and see how Moria camp is, and talk with all the local NGOs, the staff that is on the ground, take their testimonies, and bring the spotlight in what is happening currently. Thank you.
And if I can add just one last point, of course, I agree with all of you on this. It is also important for the purposes of objectivity to highlight this as an European issue. I mean, I do not want to underestimate the responsibility that the Greek state has for the situation, but keep in mind that the hotspot approach, as it is functioning today, is the immediate effect of the EU-Turkey statement. I mean, I know it's a bit banal to discuss about this time, but it is the truth. The geographical restriction is imposed in order to implement the statement. So meaning that the persons that are trapped, asylum seekers that are trapped on the islands, are trapped there as a means for implementing the statement. And to highlight the fact that, look, we are not really discussing about that many people. We give so much emphasis to numbers at times that we forget the very crucial aspect that we're discussing about persons, about Ali, about Amina, about Spyros, about whoever. They're all persons, they're all human beings, they all have rights, especially as part of asylum. And they aren't really many if we really touch upon the numbers. We are currently discussing about around 110,000 people in Greece. Not everyone remain here, because for better or worse, not everyone is eligible for international protection. But it is a bit tragic in a continent of 500 million Europeans to not be able to share the responsibility for 100,000 persons. It would have helped a lot. And I mean, this is Stefan's idea. It was a fantastic one, to be honest. If today each EU member state relocated 70 unaccompanied minors, today no unaccompanied minor in Greece, or on the islands at least, would have resided in such conditions. They would all have a shelter. So it's important to highlight the European perspective and to not allow for this to be replicated as an overall and European system once more. That's it from my side. Thank you.
Thank you very much, Spyros, and to all the panelists. And I think Spyros's point about highlighting all of this as a European issue also leads us very well to what the role of MEPs and other EU actors might be in this topic, and also with regards to their work on the pact. So that leads us on well to our next speaker, who will be MEP Fabian Keller of the Renew Europe group. She will be offering her reflections on what has been discussed so far, as well as telling us a bit more about the recent report on the implementation of the Dublin III regulation, of which she is the rapporteur, and which was a very timely and much needed report. So over to you, Fabian. Hello, Fabian. Okay.
My micro was not working, sorry. Can you, is the technique okay?
Yes, all good. Thank you.
Thank you to give me the floor. Thank you for this webinar. How can I say that? The experience and what your analysis you just shared are moving, because the situation in those hotspots are so worrying, extremely tense, and all individual human situations that have been even more difficult because of the COVID crisis, even though they were already very bad before because of the overcrowding of those spots. So thank you to Damien Beuzeleguer, my colleague. I am French. From Strasbourg. I was mayor of the city, so I feel very concerned when I hear about, you know, families, kids, and real life. I am in charge in the Libe committee of the implementation report on Dublin III, trying to prepare the discussion on the package for asylum and migration. As you just stressed, the situation in the hotspots is terribly worrying and not at all in line with our European values of humanity and solidarity. So in my report, I describe this situation in short terms, but we have this unacceptable health condition you just talked about. How can we have 42,000 people in Lesbos for a camp of 6,000 people? It's incredibly difficult. May I recall you that in a report, very interesting report actually, from the Court of Auditors on the migration policy focusing on the situation in Greece, they published that in November last year. They explained that people submitting an asylum application in 2018 were given an appointment in 2022. So we have this huge question of the time frame, the length. You can support difficult conditions a few days, but for months and years, that's impossible. That's destroying your human personality, as the Georgia explained us. EASO, the European Asylum Support Office, is trying to help in the Greek islands. They provide people to process earlier the asylum application, but they have real difficulties, the more so because in Greece they used to accept the procedures to be conducted in English, which was very efficient because then competent people from other member states could come and help, which is not anymore the case. So that makes it very, very difficult. They have so lack of competent staff for those procedures. I heard with attention to Amanda Mundos de Toro. I met another NGO in the same sector, the European Lawyers in Lesbos, where a lot of French people are involved, a lot of French legal professionals. You pointed the importance of the legal assistance. It's also an important point so that they can understand what happened and be helped in the procedure. I really believe in this volunteer lawyers help, and that it could be better supported by the European budget. In my report, a few points concerning the hotspots. I call on member states to make use of the discretionary clause in that exists in the Dublin regulation, allowing a member state to take responsibility on the application of asylum seekers from the hotspots. It's not used enough now. It would enable to relocate asylum seekers currently living in hotspots in this atmosphere of extreme tension you just described, and to provide more decent reception conditions. You underline the question of minors and children and families. Of course, it's a central issue where the family condition should be, the regroupement familial, the family gathering should be much more applied as it is today in the European countries and in Greece, even though Greece is using it a little more than other member states. So in my report, I recommend to really rebuild all the system with, actually I work with my colleagues in charge of other rules, like the return directive or the staying condition directive, reception directive. So we need to define a new system where if people appears not to be able to have asylum, we have to tell them quickly and to, with very human condition, ask them to go back, and for the others to have decent reception conditions. And it's clear that solidarity between member states must work. It cannot be the 4 or 5 countries, Greece, Italy, Spain, and Malta, who take charge of all the people arriving, because there are countries with a large maritime frontier, and we all have to take this solidarity into account. So this is, I think, the spirit of the new asylum package. Unfortunately, it's not going to be presented very soon. We hope in September with the German presidency, but clearly the situation you described is not acceptable any longer. And even though this new package is on the table, it will take 2 or 3 years to adopt it. So we have also the question of what do we do in the 2 or 3 coming years in this very specific COVID situation that make everything that was there even worse than before, as you described in a very deep manner. So thank you. Recognition to the work you do. It's a good thing you are there, because Europe is not there enough.
Thanks a lot, Fabienne, for coming. I just wanted to quickly thank you. I know your schedule is busy, and you definitely have our support in trying to find for the system across all the different files that works the best. But herewith, I pass back on to our moderator, Steph.
Thanks, and yes, thank you very much, Fabienne. If you have time, we'd like to ask you one quick question. And it's that we've been hearing for many years about the terrible things happening in the hotspots, which are not least also an EU asylum or migration management approach. And we're hearing about the incredible work and very crucial work that all these NGOs and civil society groups have been doing for years, as you also mentioned, also the legal aid groups. And yet we're also hearing that their work is especially recently being made increasingly difficult. So I'm wondering whether you see any potential, and if so, what kind of avenues you see for the EU Parliament, for example, supporting these NGOs more directly and helping to facilitate their work or ensuring that they are able to continue?
Thank you for this important central question. It's not enough to say thank you. It's how can we help? In two manners, actually. I organized a morning of discussion about the Dublin regulation in February, and I invited NGOs because, you know, it's important to hear and to feel also the emotion, because at that time it could be presential, mixed with the agencies and the representative of the national governments, because, you know, all the rules are defined at the European level, but applied nationally. So it's very important for them to listen to that also, so to give them the right place, actually, they have in the functioning of the Asylum and Migration European policy. And the second thing is the budget. Give money so they can deploy what our agency are not able to do directly. But I was really stressed in my work by the question of the time frame. It's not possible to put people so long in incredibly complex procedures that nobody can understand. I have charts and everything. It's very complicated. It's this, en français, in French, déshumanisé. It's a way to make it not human, because you cannot explain it in simple words to somebody. And so we have to reduce the time frame to tell people. And if we can't give them asylum, we have to tell them to be, you know, fair and say the truth. And those who are going to be welcome, it just doesn't make sense. All the mental health stress we are giving them is destroying human value, actually. So Europe is more and more conscious of this big issue, and the more so because probably the COVID crisis is going to put more pressure on migration because of the economic difficulties, and maybe those difficulties creating new wars or tensions in other places in the world. So it's an urgent subject. It has been 5 years since the 2015-2016 migration crisis. It's urgent to define a new migration policy.
Yes, indeed. Thank you again so much, Fabienne, for your time. Thank you. So I'll now move us on to our next panel, and may I ask all the panelists to please keep your videos switched on. Our next panel will be focusing more on what might be expected going forward, both with regards to the new Greek asylum law and the potential implications of all these developments for the proposals that might be included in the upcoming Pact on Migration and Asylum. We'll hear first from Minos Moutourakis from the NGO Refugee Support Aegean, who will be speaking to us in more detail about the new Greek asylum law, after which we'll hear from Raphael Schilhav of Oxfam Brussels on potential implications for the upcoming Pact, as well as further analysis and key recommendations from Catherine Willard of the European Council on Refugees and Exiles. So Minos, over to you.
Thank you very much, Steph, and thank you to the organizers for having me in this discussion. I think the first panel has summarized in quite a lot of detail the current situation in Greece and the lack of sustainability of managing asylum systems in that manner. What I would very quickly try to add as a preliminary remark before embarking on the Greek asylum law is that, to me, this is unfortunately an indication of business as usual for the EU. We have had a breadth of evidence and information on how people are treated on the islands and elsewhere in Greece. So I think the knowledge is there. It's more what we do with it and what implications we think this has for the SEAS as a whole, and whether actually a lot of it is designed to work in that way. And of course, the proposals that we're likely to see stemming from the Commission in the forthcoming Pact on Migration and Asylum could speak to some of those problems being repeated and replicated. To focus a little bit more on recent reforms in Greek asylum legislation, I would echo the points that Spyros made in his introductory remarks that we've had a few too many reforms in Greece. We've had a clear example of using and very often misusing legislative processes to chip away at and to reduce standards with a view to delivering political objectives. In the case of the EU-Turkey deal, the objective has been very clear and explicitly stated in the deal to return people arriving on the islands back to Turkey. And since the advent of that statement in 2016, we've had at least 6 major reforms of asylum legislation. Crucially, in addition to what has been exposed in the first panel in terms of actual impact on people's lives and living conditions, from a systems perspective, this creates quite a few difficulties. Changing the law constantly, both in Greece, but also in any other place, means we create more complexity in asylum procedures. We make them less predictable, not only to refugees themselves, but also to the practitioners, to the authorities that have to implement legal standards. And of course, that speaks a little bit and demonstrates the lack of sustainable planning of migration policy on the part of Greece and the EU as a whole. Very briefly, in terms of some of the negative effects of the recent reforms and their potential connection to the plans we're likely to see coming from the European Commission, I'd like to highlight 3 aspects. One is restrictions to the right to an effective remedy, to accessing appeals. Basically, since the enactment of the International Protection Act in November 2019, it is more difficult for asylum seekers to challenge a negative decision at first instance, because in order to do so, to lodge an appeal with the appeals authority, they need to prepare what is commonly referred to as a legal document that explains in detail the full reasons why they're challenging that decision. Bearing in mind that legal aid coverage in the country remains scarce and doesn't suffice to cover the entire needs of the population, that means very often people without the assistance of a lawyer having to prepare legal argumentation to challenge a decision in a procedure they don't really understand and in a language they don't necessarily understand. Second is the use, albeit permitted by the Asylum Procedures Directive, on derogations from the right to remain for certain types of appeals. So following on from provisions of the Asylum Procedures Directive, Greece has chosen to make certain appeals non-automatically suspensive. That means that in order for the person to be able to stay in the country while the appeal is being examined, they need to lodge a separate request. That, of course, means more complexity for the individual, but quite paradoxically, it means less efficiency for the system itself. And we've seen this in reality with appeal committees actually treating the appeals first and only after that looking at the suspension requests, pointing to a bit of a lack, let's say, of smart use of resources in that regard. A third one, which is a technical point, but one that I think merits consideration and discussion, is the different modalities used for appeal procedures. Greece has expanded in the recent reform of May 2020 a derogation provision that allows it to channel all of the island appeals into single judge composition. So that means that appeal committees would treat cases coming from the islands not in a panel of 3 administrative judges, but in a panel consisting of a single official, a single judge. This remains to be seen and to be implemented in practice, of course, but it does raise crucial quality and also objectivity and impartiality questions. And in other countries, these issues have been scrutinized quite closely by the courts. There's a recent example from the French Conseil d'Etat where a similar expansion of single judge adjudication has been ruled unlawful by the Conseil d'Etat due to the sort of arbitrary and generalized reduction of guarantees. To conclude, I think procedural safeguards should not be looked at as an afterthought in the way we build and we implement asylum systems. I think they are fundamental rights for a reason, and they are very closely and intrinsically attached to the protection we need to offer to those who seek it. So they need to be inherent in any fair design of the common European asylum system moving on. The lesson I think we can draw from the last years of the Greek experiment is that the approach of constantly changing, amending, and downgrading safeguards has severe implications for both individuals, but also for the rule of law and the way in which justice systems function. Insofar as this remains a SEAS with national competence, that of course means that what we try to set up as border procedures will affect primarily the justice systems of those member states, but it does speak to the integrity and to the resilience of the system as a whole. I'd like to leave it at that, but of course happy to answer any questions. Thanks very much.
Thank you very much, Minos. And we'll move right on to Raphael now, and we're collecting questions for the end of the panel. Thanks.
Thank you, Stephanie, and thank you, Damien, and to all the speakers. Minos, you said that all the evidence is there, and all we need to do is to apply it to what's coming next in the Asylum and Migration Pact, and this is exactly what I want to continue doing now. With all the caveats about the fact that it's very difficult to project what is going to be in the pact once it's published, but we've already seen some indications in what the Commission and the Commissioner has said and what the German presidency has indicated already in the informal council meetings. And indeed, making the comparison between what we hear and what we know, I think there's a few points that are important to highlight, even at this early stages of the discussion. There's a lot in the pact, but one of the issues that keep coming up is this discussion of, exactly as you said, is trying to, or is happening in Greece, trying to deal with asylum applications as early as possible, as close as possible to the border, both physically and legally. And we heard recently about this idea of having some sort of centers at entry points to the European Union. We heard a little bit about pre-entry screening procedure. And I think it's important to see what's there or what could possibly be there. Our understanding is, of course, that there is need to do some sort of, when someone arrives in the European Union, there needs to be some sort of identification and health checks, security checks. But then when it comes to the asylum process itself, there's been in the past years, and we see maybe also in the pact, this idea of trying to eliminate as early as possible applications that are clearly abusive or inadmissible, and track them towards a border procedure that is immediately linked with a return procedure. And exactly what the Greek law is trying to do, cut down in timelines, cut down in processes, and get negative decisions as early as possible, as close to the border as possible. And I have to say that this seems to be duplicating word for word the Greek hotspot approach and the EU-Turkey statement that is standing behind it. It's institutionalization of an emergency measure that was put in place a few years ago, and I think the Commission has said this several times. This was an emergency measure that wasn't necessarily perfect. MEP Keller mentioned the Court of Auditors report that looked into the hotspots and identified all of the problems in their implementation. And it's very, I would like to pose maybe 3 ways or 3 questions that we need to ask ourselves when we read the pact when it's published, and the way that we can apply the lessons that I've learned and that we mentioned in the first session to see how do we deal with the Asylum and Migration Pact once it's published. The first question is on this idea of pre-entry screening procedure. What does it mean exactly? In an airport, we know exactly what it means because we go physically through a process of pre-entry until we reach the passport control that either lets us in the country or doesn't. But what does it mean when someone is arriving by boat on a Greek island? Is there going to be a physical place where these people are going to be that is legally not in Europe? Are we talking about something similar to a transit zone? What does it mean if someone is not detected at sea? Let's say a situation where a boat arrives on an island, makes people make their way to Mytilene, to the town, the biggest town in Lesbos. Is there a way for police to tell them, sorry guys, you're not yet in the European Union. We are pushing you back somewhere else. And we need to decide whether you actually arrived here or not. The second question is on the ability to manage this kind of process, this expedited process of determining your legal rights, your asylum rights, whether you're a refugee or not, in the conditions that we've heard so much about right now. Yeah, there is a direct link between the expectation to manage a fast and full asylum process at the borders of the European Union with the question of how much staff can you get there? How much space do you have there? Can you make sure that you have enough housing in place? Can you make sure that you have enough health providers in place, education, mental health support, and importantly, access to legal aid? Are all those things, can you provide them in these places where you hope to run a full expedited procedure beginning to end and have a validated answer? And we heard in the first session, the situation that people are living in. Are these people capable of participating in the legal process fairly and being able to present a claim on whether they are refugees or not? This leads us maybe to the last question, and with this I will stop. To what extent can we strip down legal processes, the asylum procedures themselves, before they stop being fair? Because what we see in or what we hear might be in the Asylum and Migration Pact is a rush to some kind of a core procedure that gives answer as quickly as possible and as cheaply as possible. And we have to keep asking ourselves, is this fair or not? We've heard already about the people that are stuck on the islands for years without an answer. It's important to keep in mind also the people that will arrive in the islands and will be rejected in 5 days in detention without ever having the opportunity to talk to a lawyer that explains to them what an asylum procedure is. What is the information that they need to provide right now? What are the answers that would be relevant to this kind of process? And I will stop with a story that I remember from my childhood, a book from my childhood that my mom used to read me, and I was wondering if I should say it or not, but I think it's a good example. It's a story about a farmer that had to save money and decided to feed his horse less and less. And first he was feeding the horse once a day, and then once every 2 days, and then once every week. And then the horse died. And the farmer told himself, you know, if he just survived a little bit longer, I could have stopped feeding him entirely. And I think we need to ask ourselves, is this pact on the way of stop feeding the asylum services and the asylum system entirely? And then what are the results that we're expecting to get with that? Thank you very much.
Thank you very much, Raphael. A lot of food for thought there. And we'll move right on to Catherine Willard. Thank you.
Thank you. I've been asked to make recommendations using the Greek experience to make recommendations for the forthcoming pact. I'm going to make 3 recommendations. The first one is to continue the positive alternatives that we and others have been trying to develop. Second, to be ready for significant defensive work as soon as the pact comes. And thirdly, to be ready to engage in the politics of what will follow the pact. Starting with the first recommendation, positive alternatives. Despite the need and the questions about the pact, we still have to continue to put forward our alternative vision of how things should work in Europe. This starts with having functioning asylum systems and ensuring compliance with existing law. At ECRE, we've identified and continue to identify implementation gaps and argue that this should be the focus of EU efforts, gaps at the levels of registration, reception, decision-making, and in the use of procedural guarantees, reinforcing exactly what Minos has just said, that those are not special luxuries, they are essential parts of any legal process, and are frequently ignored or denied by member states already. And then recently, after COVID, particular attention to access to territory and access to the procedure. In addition, looking at the reform on the solidarity piece and putting in place relocation plans and a rights-based implementation of Dublin III for as long as that remains the framework. And other positive alternatives cover massively expanding legal migration for the asylum migration, but also for non-asylum migration, and inclusion of people in Europe through rights, respect, and in some cases regularization, because the large, for member states, for instance, who are concerned about onward movement, this is not our priority, but for those who use this as a reason to try to close borders, actual question of people living without regular status currently is far more of an issue than people who may potentially arrive. Now, unfortunately, what we know about the pact is that it will not represent a change of direction, and it will not consider these kind of positive alternatives that we and others have been putting forward. But nonetheless, many of these measures can and should be happening anyway. Because what goes on now in terms of asylum and migration is not happening in a legal vacuum. It's happening in one of the most complex asylum systems that exists. That framework needs to be properly complied with and reinforced. Second recommendation, to be ready for the defensive work. I would say the pact looks pretty problematic. I would also say that nobody will be pleased with the pact, and the Commission is preparing itself for hostility and criticism, and that's partly because of the nature of the subject. Europe is so polarized and so divided on the issues of migration and asylum that it would be impossible to produce a pact that pleased everybody, and possibly even impossible to produce a pact that pleases anybody. Nonetheless, I think we will be less pleased than others. It looks like the pact will be another attempt to put forward a model that involves containment of people at borders and looks to deportation as the answer through trying to rapidly return people as quickly as possible. Raphael has already mentioned some of the elements in the sort of sneak previews that we've had of the pact, including a screening and then possibly a screening to do initial filtering, followed by accelerated procedures for those who make it through that first hurdle. It's all about substandard first assessments kind of procedures with limited guarantees and rights for those who are coming. It will inevitably lead to detention. It's based on the myth that people can be rapidly deported. There's a huge risk of refoulement due to the bringing together of asylum and return procedures. And I would say this is part of, given that we've seen courts defending the right to asylum to some extent, this is an attempt to change the legal framework so that it becomes easier to deny people access to asylum, so that we can't all rely on courts as much as possible because the legal framework itself will have changed. So let me conclude with the third of my recommendations, which is to get into the politics of all this when the pact is published. So I think Raphael's three questions that we should be asking cover extremely well the potential legal problems with the pact and the legislative proposals that may accompany it. There's also then the political dimension. If we look at the 2016 SEAS reform package, it failed for political reasons and due to political disagreements. Let us see what remains the same and what has changed in terms of the politics. So as Minos rightly said at the start of his comments, the scandalous situation in Greece and other widespread violations at Europe's borders are well known. The evidence is there. I personally have sat through hundreds of testimonies as well as witnessing these situations myself. Policymakers are well aware of what's happening. Unfortunately, they consider it a price worth paying. In addition, the EU-Turkey deal is still considered a success and necessary, including by the two key commissioners who are responsible for this policy area. We still have to produce testimonies and describe what's happening, absolutely. But unfortunately, it doesn't change the views that this is the way to do this. One of the reasons this situation is tolerated by policymakers is also because of the misrepresentation of the figures. And I think again and again, we will hear the commissioners referring to low recognition rates, trying to put forward the idea that everybody arriving is undeserving. Firstly, nobody should be treated in this way anyway, the proposals go further in undermining the right to asylum. But in addition, if we look at the figures, we conclude that a majority arriving is entitled to protection. The figures often used are first instance decision making, with many of those decisions overturned afterwards, which again is not a special luxury for asylum seekers. It's an essential part of any legal process. What has changed, I would say, is the situation in Turkey, which has worsened and will get worse before it gets better. For the last commission, when confronted with evidence about the situation in Greece, and of course the commission itself is more aware than we are because they have access to all elements of what's happening, the answer was always that people should be returned to Turkey. And this was not the answer before, but it certainly won't be the answer going forward because the political situation and the treatment of refugees and asylum seekers in Turkey is getting worse and will get increasingly worse. The 2016 package, as Raphael, I think, mentioned, was based on an expansion and a codification of the EU-Turkey deal model. And the pact seems to be doing the same thing with slightly different legal tricks. What happened last time is that member states couldn't agree among themselves, and the European Parliament and the Council couldn't agree. Even when agreement seemed to be reached, the Council reneged and went back on some of those agreements. So let me conclude with a few remarks on those issues. The member states couldn't agree because there were conflicts among them, and these were attempts to solve political conflicts through misuse of legal mechanisms. One of the conflicts was loosely put between East and West, with the V4 countries and initially Romania rejecting mandatory relocation and not wanting to accept people. This is still the position of many countries, and we could even add more countries, including Austria, to those refusals to accept mandatory relocation and mandatory solidarity. However, I would argue that this conflict has been resolved. And the reason for that is because we're likely to see the idea of flexible solidarity in the pact. Member states will be able to choose from a basket of solidarity measures, and one of those will be relocation, but it won't be obligatory. A solidarity measure could be sending border guards, it could be returning people. So that may be different this time, which means that things may move faster. The other conflict was one that we can loosely call between North and South, or between the border countries and the centre. The ideas in the pact, as with the 2016 proposals, actually increase the responsibilities of the countries at the borders and create the idea that they will be managing large-scale, long-term detention centres and also be exposed to legal challenge. Last time there was resistance. I think what's changed this time is the new government in Greece. It may be possible for Greece to be bought off and this is why resistance within Greece will be crucial. But I'm not sure that Italy and Spain in particular are convinced about this idea being heavily promoted by Germany and France, before that by the Netherlands, that screening, accelerated universal border procedure, use of the fiction of non-entry to transfer everybody to a border procedure, that all of these ideas will have the support of Italy, Spain, and other countries in the south. I would say for any country at the EU's borders, this is an extremely bad deal that is being offered. A small amount of solidarity in exchange for managing detention centres, new procedures, and ending up in the situation similar to the situation that Greece is in. Finally, it will probably be harder, or I think it will certainly be harder for the European Parliament to reach an agreement on legislative proposals this time. Last time, it was still the grand coalition time, and Parliament was impressive in a sense of efficiently, quickly reaching agreement and largely defending the right to asylum and human rights within Europe. What's changed is that the European People's Party is taking a far more extreme position, anti-migration position than last time. Parliament is more fragmented, and the chance of reaching an agreement and the chance of Parliament reaching an agreement which represents a progressive stance are all things that have changed. I think we will strongly need S&D, Renew, the Greens and GUE to be resilient, uncompromising in their defence for the basic right to asylum and human rights of people arriving to seek protection in Europe, and to play a lead role in steering that debate. Thank you.
Thank you very much, Catherine, for these insights. And I'm going to move us on very quickly to one question for the panel. This was actually also submitted earlier, and it was one for Spyros, but I think that some of you on this panel might also have some good answers. So it's from Florian Ockenfuss, and it reads, what we hear in the media from the Upcoming Pact is that the Commission is embracing the German proposal of asylum centres at the EU external borders, seemingly taking the not legally defined hotspot approach as a blueprint. How do you evaluate this trend from a rights-based approach? And perhaps, Catherine, you can just start us off briefly, and we have about 1 minute for the answer. Thank you.
Yes, I think Florian, who's posed the question, is entirely right. And we would trace the current developments to the conversion of France and Germany at some point towards the end of last year to this idea of containment at the border. It is part of a longer term effort to try to find ways to prevent people from actually entering EU territory. We don't know the details. There are still major legal challenges in trying to put in place these kind of measures, and not least after the Luxembourg court's decision against Hungary, ruling that it is detention to keep people in the transit zones for longer than 4 weeks, and the unlikely chance that things will be decided within such a short time frame, amongst many other different legal challenges, including the line of cases that show the difficulty of maintaining a fiction of non-entry in cases, etc. The right to asylum as existing in the APR, APD, read with the Charter, so on. But I think, as well as those legal questions, the other issue is the political one. And we've seen France and Germany attempting to get support from the countries at the borders over the last sort of 10 months. And it doesn't seem that this has happened. And so it may not be for good reasons. It may not necessarily always be for rights-based reasons, but politically, it would still be a major error for a government in Italy or Spain to accept this kind of proposal. And I think it would also be politically disastrous for the rest of Europe, because we've already seen in Italy, for instance, how a failure to have a fair sharing of responsibility feeds into the Dublin regulation being a key issue in election campaigns, and an extreme right government being elected and then disrupting all aspects of EU policymaking.
Okay, thank you so much, Catherine. I'm afraid we're going to have to move on to the next panel now, and that will be moderated by Damian. So thank you very much.
I think we have to, in the future, plan more time for questions and answers, but this is the first larger event that we're doing with so many panelists. So thanks a lot, Minos, Raphael, and Catherine, for your great interventions on this. I would now maybe ask you to turn off your video if that's possible, and ask the MEPs, so Eric, Elena, and Fernando, to turn on theirs. I can see already Eric is there. So maybe if we get perfect, Fernando, we see you as well, and then only Elena is missing. Okay, but we can anyway start. So I mean, let me just do like a mini super fast run through what we just heard. I mean, Spyros gave us an overall update of the situation, also stressed again the fact that this is not a new situation, but it just got extremely, or the vulnerabilities got exacerbated massively during the Corona crisis. Amanda was talking about the deprivation of rights, Georgia about the horrible mental health situation, Julia about the situation, especially for minors. I mean, the idea that you're forced back into the camps to be violators if you were abused. On the second panel, and then there was an interesting question of what can we do as individuals. I think that was also shared quite a few times in the chat. The second panel, we learned from Minos that basically, I think it was Minos saying that the constant changes of law create uncertainty and low quality of processes. We heard that procedural safeguards are intrinsic to an asylum system, and that they are fundamental rights for a reason. And we heard that we really should try to we should really try to scrutinize very carefully what is coming, and we should also understand where people are legally and physically under the new pact. And then Catherine was talking about the fact that politicians think it's worth paying the price, or price worth paying, to let people suffer at our borders currently. And so I just want to say that I don't believe that is a price worth paying. So I mean, now we would hand over to Eric. Maybe first you, if you want to just give like an idea of what you take from this discussion so far, what you think we can learn for the new pact from the current situation and the interventions we just heard, and then maybe I'll hand over to Elena and Fernando afterwards.
First of all, thank you for inviting me. That's a pleasure. I was unfortunately not able to follow all the panels, but Fritz was there, and he already gave me a report about everything what was said. So in general, what I expect from the new pact, after also hearing what was said before, I don't know. I have actually the feeling that everybody who was really involved into the topic had the hope that the new pact is something better in the end, and maybe we getting more and more convinced that that is just hope in the end. So I think if we look on the reality at the external borders, I spent several weeks at the external borders already this year, and following the situation there very closely. Basically what we have to prevent in becoming law is the reality we see at the moment. So I think the basic aim should be, and that was already a little bit said in the panels, that we cannot put the reality we see at the external borders into law with the new pact. That is a very dangerous task at the moment. And I think that we already see some changes in national law, like Minos already pointed out, that the basic challenge at the moment is that we not having a situation where people try to create an asylum system, but an anti-asylum system where it's getting harder and harder to getting access to asylum. And what I learned from the discussion, I followed the last 40 minutes, also is like, I was thinking about, like, we are all in very interesting discussions, and I think we are all learning in every discussion a little bit more about the situation, but basically there is no lack of evidence. There's no lack of evidence that the environment on the Greek islands is not good for human beings, especially for children, and not good for their psychological situation. There's no lack of evidence about pushbacks. I spent 90 minutes today in the Schengen Scrutiny Group and discussing the situation at the Croatian border to Bosnia-Herzegovina, and there's really no lack of evidence that there are, like, I don't know, 5,000 pushbacks at least happened in the last year. So there's really no lack of evidence for that. We all know that. We know that it is unlawful, but also after the, I don't know, 10th discussion about the situation at the Croatian border, there's still the Interior Ministry saying, no, that's fake news. They speak a little bit more about that, but let us say they say fake news. Greek officials last week, 3 Greek ministers were in the Libe committee invited to tell about the fundamental rights situation at the external borders. They did say, like, not one word about the fundamental rights situation at the external borders. When they were asked about saying something about that, they were basically not replying the questions, but saying how beautiful the situation at the external border in Greece is, and that they're have such a big challenge, and that they are great in dealing with it. And in general, they just denying the reality, and the Commission is doing nothing about it. And if we say that there are many violations of EU law and also fundamental rights in general, then we have a situation of impunity, in a situation where we have not a lack of laws, but enough laws to find some consequences about the situation. And I'm like not out of words in general, but my question is, and maybe we can also discuss it a little bit later, like if there is no lack of evidence, if we talk about these issues every week, like all of us maybe, if we know how the situation on the ground is and we know what to do, but basically the situation did not change in a good way the last, I would say, 4 years since the EU-Turkey statement. And maybe we have to talk a little bit more about our strategy. So basically, it's not about finding new arguments, but about how to tell the story of human rights, how to tell the story of rule of law, how to tell the story of media freedom, press freedom, and how to also tell the stories of the people who suffer from the system we see in reality. And I think basically we have to focus on that if we want to win the discussion. In the end, having a pact which is focused on solidarity and not just on deterrence and violations of human rights. Yeah. Thank you.
That's a good answer. I'll come back to that narrative question afterwards. Elena, do you want to take it from here?
Yes.
What did you learn?
Yeah. Thank you, Damian. Can you hear me?
Yes, we can hear you.
Thank you, Damian. Good afternoon, colleagues. First, let me add some words from my side on what was just commented in the other panels. COVID crisis once again showed the importance of the contingency planning in the asylum policy and asylum system. The asylum system should be able to adapt to the dynamic situation on the ground. On the question of detention, as shown from the intervention made in the previous panels, detention per se cannot solve anything. On the contrary, it can have negative impact, contributing to the further deterioration of the situation. Moreover, it's not only the detention. We need to remind ourselves that the geographical restriction in general is a tool for managing the asylum system and not a tool for detaining people. And again, we need to assess the effectiveness of those measures. And for this case, the Greek experience, especially the experience in the hotspots and at the islands, is extremely valuable to this regard. Let me also share some views on the Upcoming Pact. The European Union asylum system has several building blocks. It is of really great importance to ensure that the new proposals will complement each other and their provision will be mutually reinforced. This is extremely crucial. Every measure should be assessed not in isolation, but in the context of other measures. And this is extremely relevant when we talk about the prescreening, about the border procedure. This is very important when we are talking about detention. And those measures cannot be backbone of the new pact. They can be discussed and developed, but only as a part on a bigger picture where the balance between solidarity and responsibility will be ensured. And now, as a rapporteur of the new asylum agency regulation, let me add some words in this regard. Last year, European Union received one third of the global asylum applications. Most of the applications are concentrated in several member states only. And in order to work under such pressure, the European Union asylum system should be backed up by effective legislation and effective structures. When it comes to European structures and at EU level, in the field of asylum, we have just one, EASO. As of 2015, EASO was brought to enhance its operational support, especially in member states, at the EU external border located at the Mediterranean. And EASO operational support has been key in the setup of hotspots. When people ask about more European support to the member states and the pressure, they actually ask for more EASO on the ground. Still 5 years after the crisis of 2015, European Union lacks a fully fledged agency in the field of asylum. The pressure in many member states, Greece in particular, is still high, and we still don't have European solution to answer collectively to all those challenges. During the recent years, we upgraded all European agencies in order to be prepared to respond to new dynamics that occurs on the ground. And while we enhanced Frontex twice for less than 2 years, the activities of EASO in the field of asylum are still quite limited. And making the EASO more independent, enhancing its power and resources, and further strengthening its monitoring role will answer half of the questions that we are raising today.
And I need to sadly ask you, I think, to come to an end so that Fernando also has the time, and we have 1 minute.
Just a few words. I'm sorry. Yes. So we need to use the lessons learned in a very objective and honest way, and to provide for new solutions within our legislation. And EASO is the answer of that. And as Eric said before me, it's not just hope at the end. I hope at the end we will see a new asylum agency that can work on the ground and can resolve the problems. Yes, thank you, Damian.
Thank you, Elena. Fernando, if you can keep it short, then we have some time to discuss as well, but take your time.
Okay. Good morning, everybody. And first of all, thanks, Damian, for this kind invitation. I want to start with some reflections regarding migration management in Greece, and have to say that we can see a quick, radicalization at both levels of policy action, both action and speech. The government not only implements inhuman policies at sea or in the hotspots that are increasing in what is the level of cruelty and remoteness of European and international legislation, but above all, the government delivers it with pride and with a lot of noise as his duty towards the Greek citizen. Ministers are using rhetorics and implementing actions, even if sometimes only symbolic, in a way that gives the impression that they want to reinforce the ideas of the extreme right. And all their behavior seems to have a double objective. On the one hand, to show that Greece is a hell, so that people do not come, and incredible as it may seem, to bring people closer to xenophobia and racism. All this has to be seen within the Greek context. The mass media is strongly controlled by the government that promote its actions and its rhetoric, and in parallel, discredit any progressive, democratic, and pro-human rights voice. And at the same time, we have the European context that is not easy either. Total failure of the common asylum system, advancement of the idea of absolute control of the union's external borders, along with the tendency to externalize borders and limit the rights of those who ask for asylum, and for Greece, hegemony of a logic that says, well, give them money to take care of the borders and to stay with the people there, and we will close our eyes to rights abuses. And here comes the role and the obligation of parliamentarians and parliament. I will make 4 proposals on the ground that collective ways must be found among parliamentarians too. First, have mechanisms and tools on the situation communication in order to be able to share the information necessary to react or act quickly in urgent matters, such eviction of refugees from their homes or when a ship is unaided at sea. Secondly, ensure that the right pressure arrives at the right time to those who have to get there, the Commission, the Greek government, or any other institution, with the aim of influencing the situation on the ground as soon as possible and as well as possible. And for these 2 points, we have seen concrete results with the case, for example, of the Iraqi girl who wanted to return to Turkey and separate her from her family, or in the case of eviction of refugees. 3, offer an alternative rhetoric to the existing hegemonic one, and it's reproduced in Greece. And not only helps and gives strength to those actors who fight for the rights of refugees, but also to the extent that it is reproduced by the media, it's an obstacle to the advancement of xenophobic and racist ideas. It creates a space where other people outside of the usual people put forward democratic ideas and rhetoric reinforcing these logics in the public debates. And finally, and fourth, try to form and endeavor progressive alliances in the European Parliament in its way of intervening, either by letters, debates, resolutions, or positions in the formation of legislative acts. Right now, just before receiving the proposal for the common asylum system from the Commission, this is very important, really knowing what is happening in Greece and working against this. We know what will the European system will look like in the future. And we have to face this with knowledge of the current situation and organizing constant work networks.
Perfect. Thanks a lot, Fernando. That's a very good summary as well. I mean, I think when I hear you talk, I see that there are 2 ways that we can try to work on this, and that goes back also to I think what all of you mentioned on strategy and on narrative. And I think one is the communication battle, if you want, and the other is the legislative battle. And I think my open question here is just building also on what was written then in the chat and while Eric was speaking. And I mean, also Eric, your experience with trying to launch quite successfully like a public campaign, Leave No One Behind, with many other actors, but also definitely you being instrumental behind that. I mean, what did you learn from this exercise, and how can we scale this even further to ensure that on the communication side, we can make a better job and trying to increase public shaming?
Yeah, difficult question. What did I learn? No, I think basically what maybe the starting point of some sorts about campaigning is are you familiar with Harry Potter? Maybe. Absolutely. I don't know. I had the thought that we are discussing about like who is in Gryffindor, who is in Slytherin, and who are the good and the bad people. But most of the people in the world do not even know what Hogwarts is. And basically, if we talk about a new regulation, I don't know, if we talk about a asylum procedures regulation or something, I think that 99%, maybe 99.5% of the people in Europe are not able to tell you something about it. They don't know what the asylum procedures regulation is. Maybe 99, maybe 98, I don't know, but big majority. And I think that we have to understand that our discussions where we have a normal life, which is based on doing politics all day and being happy if we have 10 minutes a week where we do not spend our thoughts on politics, is not in line with the majority of the people who are happy when they have 10 minutes to deal with politics in the end and democracy, and only us knowing how the situation at the external borders is, only us knowing how bad the answers in the Liebe Committee from the Greek ministry are, does not lead to a situation where you having people engaged in the topic. So the starting point should be to make people feel informed and also give them a possibility, let us say platform, where they have the possibility to express their thoughts and also their goals and stuff. Yeah, that's somehow.
I think, I mean, I agree. So the question is a bit how to, decrease the threshold for engagement on the topic so that people can just feel ownership for it and also like be part of it and create this understanding. Yeah.
Okay,
probably easier said than done.
Can I say one point for that? You have to find celebrities who are not only able to paint. You have to make them engage and use their followers to reach more people. That is one thing I think which is important in the end. Sounds a little bit stupid, but in the end you need outreach, and I think you need people who engage with the topic and not only some testimonials as most of the campaigns did in the past. So that's, I think, one advice, that we have to engage with people who are close to us politically, and to kind of work together on really campaigning for human rights.
Makes sense to me. Maybe, I don't know if Elena or Fernando, you have a point to make on this kind of public outreach, or it could also be on the defensive strategy legally, or in terms of our legal kind of work.
Yes, yes, Damian. The key is to make our voice of the parliament to be heard, because I have the feeling our voice is not so strong for the moment. In like the council, this house has a view on the reform, and we should raise our voice, and we need to invest more really in explaining our position, and we need to give direct answer. To be honest, so far we haven't heard fresh ideas from the Commission, and we need to insist on this.
That makes sense. I would also, like, since we're over time, and like if you need to leave, do tell me, but like if there are anyone else from the other panelists with ideas on strategy, please just unmute yourself and show yourself. And I saw that there was a hand raised, so if you're interested, do tell us. Fernando, do you have a thought on this, on the question of strategy and outreach?
Well, I would only add that we are going to live in some weeks a very important moment for this issue. Some weeks we will get in the Parliament the new draft on asylum and migration policy by the Commission, and I think that that will represent a very important moment in order to fight all those problems that have arisen in this conference that we perfectly know. Migration and asylum policies will be in the front pages of the media and in some months, and I think that we have to grasp that opportunity within the Parliament, within the parliamentarian work, in order to give the importance this issue has to all the European citizenship, and to try to advance sometimes the progressive majorities we have been able to get in the LIBE committee, in order to correct, if possible, the approach of the Commission in this issue, on this issue that we already know will be a bit restricted. It will be a big challenge, but I think that the issue is also a big one, and it deserves all our attention.
Perfect. Catherine, maybe as a last question, and then our intervention, and then I think
yes, thank you. In response to that question on strategy, I think we need to accept that we need to be working with multiple strategies at multiple levels. And it's not a question of, is it better to engage in changing the narrative, or is it better to do defensive work to defend the legislative framework that we have, even though we know it's not ideal and we would like to change it. We have to do all of those things, and there will be roles for everybody in the next few years, but as there have been over the last 3 or 4 years. And I think the situation would have been much worse had we not seen the engagement, and not to be immodest, I talk about my colleagues who engaged and worked closely with the Parliament on the previous legislative proposals. In terms of changing the narrative and the public campaigning piece, it's crucial who is the messenger, who is talking about these issues. I think Eric's point about engaging with celebrities, for instance, is very important. Personally, I would like to see the private sector more active and more visible on this. We know that there are many parts of the private sector that are supportive. Angela Merkel would never have taken the stance she did if she didn't have the support of industrialists in Germany. But they remain quite silent. In addition, people with a refugee background, and we've made a massive effort to try and include in all aspects of our work people with a refugee background to talk about the issue themselves. I think sometimes when human rights NGOs are there carrying the message forward, sometimes it can be counterproductive, because it's taken as lecturing, and the people in the middle actually are more likely to turn away from the issue. So we also have to be modest in terms of when a loudmouth human rights lawyer is the right person to be taking forward the argument. Thank you.
fully understand. I would now actually officially close the event, and we will stop the live streaming. But I do want to actually give the opportunity to people who still want to talk to each other on this to stay, because I know that Raphael does want to add another point, but we will we'll close the official event. So if you have to run to the next meeting, please feel free to do so. If you want to stay, please feel free to stay. So Raphael, you wanted to add something?
There's just two more points on top of what Catherine said, which I completely agree with. One that you mentioned, which I would like to mention again, the participation of people with refugee backgrounds in the conversation.